Hello, everyone, and thank you for joining me to start discussing your Medicare planning or our Medicare planning. Now, if you've seen my videos before, they always come out right before the annual enrollment period around October 1st. So why am I sending this video early? Well, by now you should have received a flyer in the mail from me, which introduces us to the Inflation Reduction Act, recently signed into law by the Biden administration, and its impact on beneficiaries just like yourselves. And so today we begin the first of a two-part series leading up to the annual enrollment period and planning for next year. And today, we're going to explore how this groundbreaking legislation, the Inflation Reduction Act, will impact the Medicare beneficiaries in 2025. And I think after this presentation, you'll have a better understanding of the hows and the whys of the Inflation Reduction Act. That's step one. And then step two, second part of our series, you'll be getting another flyer from me in the next few weeks, along with texts, emails, and voicemails reminding you that annual enrollment is upon us. And this year, we can expect to see more movement than we have in years past. And that could mean higher costs for medications, premium changes, plans not renewing, or loss of provider networks. And the most important thing that we can do is to educate ourselves and to plan. And of course, that's where I come in. Now, many of you watching have been doing annual reviews with me for years. So please, if you haven't, take advantage of being informed and plan your Medicare strategically. And very important, please, think about your friends and family who are also on Medicare. They need to know this information. So please be a hero and pass this on. So now let's go into the presentation itself on the Inflation Reduction Act. Let me share my screen here. Okay, so 2025 Medicare updates, the Inflation Reduction Act, and what you need to know. So we're going to go over the Inflation Reduction Act, what it is, how it works, and what impact we're expecting on Medicare. Okay, now we're going to go over why these changes are happening and how they're going to affect you. And then again, to prepare next steps so that you're ready for next year. So beginning, what is the Inflation Reduction Act? You may have heard it mentioned in the news or in various places. So what is the Inflation Reduction Act? Well, it was signed into law by the Biden administration on August 16, 2022, and it was designed to do a few different things. It had some designed to help meet climate goals, as well as to benefit many vulnerable populations, including Medicare beneficiaries. So the Inflation Reduction Act itself has many different arms in a few different places of economy and society. But of course, for today's purposes, we're going to focus on what does it mean for Medicare beneficiaries. So really the goal for Medicare was to improve in several ways, including lowering drug costs, expanding benefits, and stabilizing prescription drug plan premiums. So we're going to see if it's going to do all that, and if so, at what cost. So let's take a look. So some of the updates affecting the prescription drug coverage. So the Inflation Reduction Act actually began last year in 2023, with one of the main updates being the Part D cost sharing for members surrounding insulin copays. So in 2023, the government actually put a cap on the insulin copays, capping it at $35. It also expanded the Extra Help Program, LIS, Low Income Subsidy. This is a program for many people who are on Medi-Cal, have the Extra Help Program. It helps pay for some of the costs associated with prescription drug plans, premiums, deductibles, co-pays, and things like that for medications. So you're either on extra help or you're not. It is an income and assets-based program. It has recently been expanded to up 150% of the federal poverty limit is the maximum amount earned to qualify for the program. If you have any questions on the Extra Help program, let me know. Structurally, one of the other changes you may have heard about in the news, it allows Medicare to negotiate directly the drug price with the manufacturers and to work to lower the prices for drugs that have high consumer costs. And drug price inflation limits, it limits the Medicare drug price increases to the level of inflation. So hopefully we see not too much of an increase in cost relative to inflation. So what is changing in the prescription drug Part D benefits? Well, the main shift, the cause of this shift comes down to money. Who's paying what? So if you're going to the pharmacy, picking up your medications, and your medication, say it's a $0 copay or a $5 copay or $50 copay, you understand that that's not the cost of the medication, your copay. Your copay is a portion of the cost. And then there are other participants in the cost of your medication. So there's two other participants in the cost of your medication besides you. We have the drug manufacturers themselves. They are now going to be required to pay more, probably in the way of having to create additional discounts for that Medicare negotiation. So they're going to be, on the hook more financially. And then the insurance companies themselves, your Part D prescription drug plan, whether you have a Medicare Advantage plan or a standalone Part D prescription drug plan with your Medicare supplement plan, either way, your drug plan is going to be bearing more of the burden of medication costs. And so ultimately what that means for you, the Medicare beneficiary, you can expect your drug costs to go down because these other entities are paying more. So we will see how that all plays out. Again, we don't have much in the way of details for next year, not until October 1st. So this is just step one, is kind of making us aware that there are going to be some changes coming, and what do we need to do to stay ahead of any of those changes. Okay, so that's what's causing all of this. It's the fact that, really the insurance companies are going to be paying more. So how are they going to deal with that? Okay. Some of the changes for 2025. One of the big ones is, for the first time, Medicare is instituting a maximum annual out-of-pocket cost for prescription drugs, capping it at $2,000. Okay, so that means your max out of pocket, which you've never had for prescription drugs before, is now going to be capped at $2,000. This really is supplying and affecting people who are taking more expensive medications, okay, brand names and things like that. So up until now, the Medicare prescription drug plans have always been categorized into 4 stages: deductible, initial coverage limit, the donut hole, and catastrophic coverage. Well, moving forward, starting January 1st, there's only going to be 3 stages. The first stage will remain the deductible. If you're on a plan that has a deductible, this is a medication deductible, not a doctor visit deductible, but for your medications, if you're on a plan that has a deductible, the maximum government allowed deductible next year is going to be $590. So if you're on a plan with a deductible, you're taking an expensive medication or a higher tier medication, you're going to be responsible for meeting that deductible first before the plan starts to kick in. And this is for the calendar year 2025. So once you've met your deductible, or if you're on a plan with no deductible, now you're into stage 2. Stage 2, the initial coverage limit. Here's how stage 2 is going to look next year. You're going to pay 25% of the cost of your medications. Very simple, 25%. And you're paying that 25% up and until you reach the $2,000 max out-of-pocket threshold. Okay, so you're capped at $2,000. If you're taking cheap generic medications, you're not going to get to $2,000. If you're taking more expensive medications, brand name medications, you could max out at $2,000. The other big change, as I mentioned, instead of 4 stages of a drug plan, there's only going to be 3 because the government is eliminating the donut hole. If you're not familiar with the donut hole, or you are, need a reminder, it's that point in the year based on your medication costs. So this is really affecting people who are taking expensive medications. But when your medication costs reach a certain amount, you might notice a spike in your pharmacy copay. That's because you've entered the donut hole. Starting next year, that goes away. And then the third thing that they're doing is they're allowing you to spread out your prescription drug costs over the year to help kind of smooth out your budget a little bit. So for example, if you have one prescription that costs $300 every 3 months, you'll now be allowed to break that up over 3 months. So what's next? Well, we have to be informed and we have to be ready. So because we may see changes on Medicare Advantage prescription drug plans and standalone prescription drug plans. And so here's what consumers should know. These changes can have an effect on your existing coverage or costs. And also, very important, keep an eye out for your annual notice of change letter. This is coming from your insurance company. Usually it comes around the end of September, beginning of October. And this is going to outline any changes to your current plan, which may include premium changes, updated copays on different drug tiers, and drugs changing tiers or being removed from the plan. Okay, so in summary, Inflation Reduction Act changes to Medicare Part D have benefits for many, many Medicare enrollees. They're going to add value by capping out-of-pocket drug spending at $2,000, removing the coverage gap or the donut hole, and then smoothing the cost of prescription drugs over the year. So, again, once we get into October, we'll have a little bit more specifics, and then we'll be able to start to review your specific plan for next year. My service to you is to help you navigate these changes, whether you're turning 65 or you're on Medicare already. These are important things to know for next year, okay? So I'm going to stop sharing my screen right now. So I know, it kind of sounds a little, two-sided. We're hearing that for some people, there could be some relief. For other people, they may experience some changes, in costs going up and things like that. So, I will tell you that already there have been people that have really benefited from this. Did you know that before 2023, there was no cap on insulin? So people who were diabetic and taking insulin, and because of the donut hole, again, the spike in the medication costs, many people couldn't afford the insulin and they just stopped taking it. And so in 2023, that provision in the Inflation Reduction Act that capped insulin at $35 with no donut hole, that really helped a lot of people. So that was kind of the first iteration of, some of the positive changes. Now, again, we're not going to know specifics until October 1st officially. You may learn some things a little bit sooner than me. Again, with the very important, your annual notice of change. Your insurance company is going to send that to you. Annual notice of change, we call it ANOC. This year especially, please look out for it. It's and tell your friends to look out for it. It's your first clue as to how the Inflation Reduction Act will affect your plan next year. And so that's one of the things we're going to use to compare for next year. And definitely tell your friends to look out for their ANOC, annual notice of change. Okay. Obviously, the goal every year is to get as much benefit as possible and pay as little as possible. So when you and your friends schedule the review appointment with me, have the ANOC. We can refer to that as we do our review. And then I'll advise you if there are any better alternatives for you, or if you should just keep things the way they are. In the meantime, if you do have questions before before our annual review appointment, please do reach out. Just understand that before October 1st, I have very little specifics for next year. Again, this is just the first steps. The next step, the second part of our series is going to be the next video, which kind of officially kicks off the annual enrollment period. We can begin to schedule reviews right from that next video. So in closing, what's next? Step one, share this with your friends and family. We owe it to our community to share this information. And I always say, me and you can end up being heroes. Okay. Step number two, for those of you who want extra credit and want to get a head start, you may remember that in my past videos, I always included a short questionnaire asking about your medication updates and things like that. Well, this year, to be a little more efficient and organized, I'm still asking you to complete a questionnaire before our appointment. But this one's going to look a little bit differently, should be a little more streamlined and easy. It will ask you to enter things like your medications, your doctors, a few other details, and that's what we're going to use to do your review and comparison for next year. So please, in this email or text, however you got this, there is going to be a link that says, click here for the Head Start extra credit. You can use that link to get the head start. And keep in mind, this is going to be my first time using this particular questionnaire. So if there are any glitches, just let me know. Step three, again, watch the mail for your ANOC, your annual notice of change coming from your insurance company. It might be coming from United Healthcare, AARP, Anthem Blue Cross, Blue Shield, WellCare, Humana, Scan, Aetna SilverScript, Cigna, Alignment, Molina. So look out for that. And at the beginning of October, when you start receiving my flyers, emails, texts, and voicemails, yes, this is that important. Schedule your review right there in the email. Step number 5, be healthy, be happy, and I look forward to speaking with you and your friends and family and getting you prepared and adjusted for next year for your Medicare plan. I will talk to you soon. Thank you.